Healthcare workers, patients, and politicians came together for rallies across the province today, including one right here in downtown Toronto to protest the Ford government's so-called inaction on the hospital crisis and attempts to privatize.
Fix it, don't sell it! Fix it, don't sell it!
Healthcare is flatlining, overworked, underpaid, overwhelmed, underfunded. Keep our healthcare free. Don't privatize. These were just a few of the messages members of the public delivered to the Ford government as they rallied on Hospital Row.
It's just absolutely terrible, atrocious what they're doing. And right now, I'd be afraid to go into a hospital.
Afraid as wait times in hospitals skyrocket, surgeries are canceled, and even sick children are turned away from overflowing emergency rooms. Physicians shared firsthand accounts of the disturbing realities they're witnessing.
I have patients waiting 3 to 5 days on ER stretchers, waiting for a bed to be admitted to. I have patients with chest pain who are waiting 8 hours for an EKG. We've never seen a more serious crisis situation.
Healthcare professionals rallying today believe the Ford government is intentionally manufacturing a crisis to justify privatization. They point to a recent report from Ontario's budget watchdog, which revealed the government's healthcare spending was almost $900 million below budget in the first half of the fiscal year. This while almost 100 emergency rooms, ICUs, and maternity wards temporarily closed in recent months, and there have been more than 1,000 occurrences of Code Zero in Ontario this year, when all ambulances in a region are unavailable, according to the Ontario Health Coalition.
If this isn't the collapse of our hospital system, what would define the collapse of our hospital system?
In a statement, the Ministry of Health tells us Ontarians will always use their OHIP card to receive healthcare services across the province. We are proud that Ontario has and will continue to have one of the largest publicly funded healthcare systems in the world.
He's denied privatization every time we've asked. He said the OHIP will always be there for people. What do you say to that?
I don't think he's being honest. When he uses the word innovation, that's the code word for privatizing.
Fix it, don't sell it! Fix it, don't sell it!
Do you think protests like this will make a difference? Do you think the Premier and the Health Minister are listening?
They are absolutely listening. This government responds to public opinion. I am more motivated than ever to turn around and walk right back up the street and keep fighting this fight at Queen's Park.
And hearts with encouraging messages have been placed outside some Toronto hospitals with the goal of boosting the morale of healthcare workers and showing them the public is here supporting them. For City News, I'm Tina Yazdani.